of the speaking criteria. The OET speaking subtest is assessed on two sets of criteria. The linguistic criteria focuses on the accuracy of your language, while the clinical communication criteria is on how effectively you can communicate in a real-life workplace context. They are able to do this using the two role plays, Role Play 1 and Role Play 2. An awareness of the assessment criteria gives you an opportunity to recognize your weak areas and improve upon them. The level descriptor helps you to understand what the desired performance is in order to get a good grade of grade A or grade B in linguistic and as well as clinical communication criteria. In linguistic, your accuracy of speech is important, but remember that accuracy alone is not enough. As a healthcare professional, you are also expected to have strong communication skills that are necessary to ensure that you show compassionate and clear understanding of your patient's needs. Your linguistic criteria will have 4 areas. This is the area of intelligibility, fluency, appropriateness of language, and resources of grammar and structure. Intelligibility refers to how well and how clearly a candidate's speech can be understood. It is affected by aspects of speech such as pronunciation, intonation, stress, rhythm, pitch, and accent. Now, pronunciation refers to the way that a letter or a word is spoken. Remember that you do not need to speak like a native speaker. Your aim is to pronounce words in a way that it is easily understandable by your listener. So even if you pronounce it in the British pronunciation or the American pronunciation or another pronunciation, it's absolutely fine as long as your listener and your assessor can easily understand what you've just said. It's also important to use the right stress and also to avoid speaking in a monotonous tone or with little changes in your pitch. Ensure that you vary the high and low frequencies of your voice to draw the attention of the listener to the important components of your speech. So say for example, you wanted to highlight a very important recommendation. Do not use a monotonous tone. You don't just say, I highly recommend that you see the nurse on Monday. Everything on that is exactly the same. What you want to do is give a little bit of stress on the words very important. So the way that you will say it would be, it is very important that you see the nurse on Monday. So the stress is on those 2 words, and it ensures that the listener understands that this is a very important recommendation. Intonation is also one of the criteria that's being checked under intelligibility. Intonation is the melody of your speech, and it refers to the variation in your pitch. Basically, intonation can be used to emphasize an important word or to signal whether you are asking a question or making a statement. Say, for example, you wanted to make a statement that your patient has asthma. You might say you are asthmatic. But if you wanted to double check this information with your patient, whether it's right or wrong, you should change your intonation into a question. So we're using the same words, but changing the intonation to signify that this is a question. So we're going to say, you are asthmatic? As you can see, the way that I've changed the intonation from you are asthmatic statement to you are asthmatic, is in basically signifying that one is a statement, the other one is a question. The next part of linguistic is fluency. In fluency, it refers to the rate of your speech. In other words, it means the ability to speak easily, reasonably quickly, and without having to pause frequently to recall a word to express what you want to say. Pauses are not bad. They can actually be used strategically to highlight important parts of your speech, as well as to encourage patients' understanding and participation. It is, however, important to remember that if you pause too much because you are lacking in vocabulary or you're looking for words, there is a big chance that you will lose marks for fluency. The goal of fluency is to achieve a speech that is smooth and not broken into fragments. Another thing to remember in here is to speak at a natural speed. If you're speaking too fast, it might be difficult for your listener to absorb what you are saying. Likewise, if you're speaking too slow, the listener might feel frustrated while waiting for you to finish, or there's a risk that you may lose the flow of the argument. The third criteria under linguistic is appropriateness of language. Now, this criterion assesses your ability to explain things in a clear language that is easily understood by your patient, and also to adapt different tones and register to deal with different patients and their situations. You've got to remember to avoid medical terminologies and instead be able to explain the facts of the consultation in a manner that your patient will understand. So avoid using words such as myocardial infarction. All you're going to say is the commonly known word heart attack. When communicating with patients on sensitive matters or topics, that they might feel uncomfortable, you'll need to choose language that puts them at ease. So instead of asking, "Have you ever been pregnant?" you might choose an indirect question which sounds more respectful and more understanding of your patient's sensitive information. So instead of "Have you ever been pregnant?" you can change this into "Can you please tell me if you've ever been pregnant?" The last part of the linguistic criteria is assessing the resources of grammar and expression. In this criterion, it assesses your ability to use a range of grammatical structures accurately during the time that you are speaking. What you need to do is to aim for grammatical accuracy, as grammatical mistakes can sometimes affect the clarity of your communication, and it also will make you sound unprofessional. What you can do to make improvements on test day is to make sure that you can form questions correctly. For example, practice those questions that you often ask your patients when you are investigating their presenting complaints or when you are taking their medical history. Questions such as, "How long have you had this symptom?" "When did you first notice this symptom?" These are the type of investigation questions that are quite good for you to practice in advance, as it is very typical of the tasks that you are going to do in the speaking test. Under the clinical communication criteria, we've got five lists. The first one is relationship building. The second one is understanding and incorporating the patient's perspective. The third is providing structure. And then the last two is information gathering and information giving. The five clinical communication criteria are the ones that the candidates will be assessed on. Each criterion is further divided, as I've mentioned, into different sub-criteria. These are the skills that a healthcare professional relies on in your daily work in order to have a successful interaction with your patients. These skills do not stand alone, but rather they exist with one another to ensure a patient-centered communication. Under relationship building, it will assess the way that you initiated the interaction appropriately. How well did you greet your patient? How well or how good is your introduction? You will also need to demonstrate that you are attentive and respectful, and also that you're adopting a non-judgmental approach and showing empathy for patients who are probably in a predicament or in an emotional state. For example, your patient Mr. X has been referred to you by a physiotherapist for a return to work plan. What you can do is say something like, "Good afternoon, Sam. I can see that you've been referred to me by your physiotherapist for a return to work plan. That sounds really good. But in your own words, can you please describe your rehabilitation progress in the last few weeks? Do you still feel any pain? Are there any massive improvements? And anything else that you feel I need to know?" The way that you greeted the patient signifies that you have an existing relationship and that you understand the background of the problem. The word "that sounds good" means, you're signifying that there are improvements in the condition, and you wanted to give the patient a chance to tell you what has happened since the time that they've met the physiotherapist, so that you can make the best decision as to whether they are ready to go back to work. The second criteria under clinical communication is understanding and incorporating patient's perspective. Remember that the most important part of interviewing a patient is actually focusing on the patient themselves and actively listening to what they are saying. What you need to do in here is ensure that you are attending to the patient's comfort, that you're able to ask them permission and consent in order to proceed, and be able to be sensitive to potentially embarrassing or sensitive matters. In this example, you're going to inform the patient about the problem and letting them know that you will be examining them and you would like to seek consent in order to proceed. So the way that you are going to speak could be something like, "What I would like to do, Sam, is to spend 20 minutes with you so that I can discuss your problems and also examine you afterwards. Is that okay? Please let me know if you experience discomfort at any time." So you've explained that the time issue will be around 20 minutes to discuss the problem. You've informed the patient that you're going to examine them. And then you've asked for consent by using the words, "Is that okay?" And you've also given them a chance or the option to tell you if there is any discomfort during the examination. Under the third criteria of providing structure, there are further sub-criteria. Number one, you need to ensure that you are sequencing the interview properly and logically. Number two, that you are signposting changes in the topic. And lastly, you can also use some organizing techniques during your speech. In this example, we've got two tasks. Number one, you're going to ask the patient about their past health issues. Number two, you're going to recommend treatment options. So what you want to do is sequence the interview. Sequencing means an ordered approach which will help both yourself and the patient in order to have an efficient and accurate data gathering and information giving. What you can say is something like, so here's what I'm going to do, Sam. Number one, I'm going to ask you some questions to get a detailed picture of your situation. And then I'll take you through some treatment options. And finally, I'd be happy to answer any questions that you may have. May I proceed? So as you can see, I've given the patient a list of things that I will do. I've also given them or asked them for consent in order to continue with the interview. In this example, we've got a patient who's informed you about several problems. Number one, they've informed you about their joint problems and their tiredness. And then lastly, that they are also having issues coping with their children. In here, signposting would be a good skill to do. Signposting is a skill to enable the patients to understand the structure of the interview by making the organization much easier to follow. You can say something like, so Sam, you've mentioned two areas that are obviously important. First, you told me about your joint problem as well as the feeling of tiredness. Lastly, you've also mentioned how you're going to cope with your kids. What I'd like to do is to start by asking you a few more questions first about the joint pains, and then after that, we can come back to your difficulties with your children. Is that okay? As you can see in here, I've also again given a list of two things that I'm going to do, but I have clearly informed the patient that I'd like to focus or prioritize the information about the joint problem as well as the tiredness, and then after that we will discuss the difficulties that she's having in coping with her children. So signposting basically gives your patient a chance to understand what you are going to do and why and in what order. Now, the last thing that you can do in here is basically use several different organization techniques, such as categorization, labeling, chunking, repetition, and summarizing. When you're doing organization techniques, it's very important for you to learn this in order to give a very good explanation. Your explanations should be well organized so that it's easy for your patients to follow and to stay focused. Number one technique could be categorization. This is a technique in which the health professional basically warns the patient about which categories of information are going to be provided. For example, you can say things like, there are 3 important things I want to explain. First, I want to tell you what is wrong. Second, what tests we should do. And third, what the treatment might be. By mentioning categorization, so category 1 would be the problem. Category 2 would be the different testing and investigation, and category 3 would be about treatment. By categorizing the three different areas, the patient will be able to follow what's happening very quickly and easily. Labeling basically is highlighting certain components of your explanation to emphasize importance. So instead of just saying, I'm recommending this, you can say, I am particularly recommending this, say for example, this visit. Okay, by using the label particularly important, basically it leads the patient to understand that you are emphasizing or making that recommendation quite important for them. Now, chunking is basically a technique in which you're not giving all the information in one go, but you're giving it into chunks, meaning you're dividing them into smaller amounts. So rather than just saying, we're going to do this and that, you're going to say, we're going to do this. And in order to do this, this is how the process is. After that, we are moving on to step number 2. And under step number 2, this is the explanation. So chunking is basically not giving a very fast information, but giving it in summary with a little bit of a detail. Another one is repetition. It's basically repeating what you've heard from the patient in order to get confirmation. So if the patient says that their pain level is 10, you can repeat that and say, you've mentioned that your pain level is 10. Is that correct? Okay. So basically, you're listening to what your patient is saying and you wanted to confirm it as well. The last technique in organization is summarizing. And summarizing is quite good when you finish all the tasks, but it doesn't look like the 5 minutes is finished. So the skill of summarization would be a good one in here to let you carry on speaking. What you're going to do is basically pick and choose a few information from each of the tasks. From, if you got 5 bullet points, maybe you'll pick the 4 bullet points and just use the highlight of this. So you might say, let me just recap what we have discussed today. Number 1, I've explained the condition to you. Number 2, I've given you the different options for investigation. And number 3, you've told me that you will need some time to analyze those information and you will call me in 2 days. Is that correct? So summarization is a very good skill to use when you've done all the tasks and basically you need to speak a little bit more in order to finish the 5 minutes of recording. These are all different types of criteria that is part of patient-centered, and as you can see, it's all revolving about or around listening to your patient properly. The other 2 that are side by side is information gathering and information giving. Okay, when we are gathering information, it's basically facilitating or eliciting answers from our patients and basically minimizing interruption when they are speaking. In this skill, it's quite good to learn all about how to ask open questions as well as when to ask closed questions. The combination of these 2 will help you clarify some statements and also be able to summarize information to encourage your patient to give further information or to invite the correctness of those information. A closed question are questions which can be answered by a simple yes or no. Okay? Are you in pain? Yes. Are you in pain? No. Okay? The close questions limit the response to this type and just basically gets you a very quick information about your patient. If you want to find out details, you'll need to ask open questions. Open questions are questions which cannot be answered simply by yes or no. Many of these questions can be asked using the question why, where, who, when. These questions will still direct the patient to a specific question, but it allows them more discretion in their answer, and also the patients are welcome to give more details. So instead of just simply asking, "Are you in pain?" you can say, "I understand you're in pain at the moment. Can you tell me a little bit more about the pain that you're feeling?" In this case, the patient might say, "Yes, I'm still in pain. The pain is right about the lower back area." So the open questions basically give your patient a chance to give you a little bit more detail. The very last skill that you will be assessed on is information giving. Basically, in information giving, the patient requires some clarification or perhaps some explanation, and you will be asked to give those information properly and correctly. So one thing that you can do in information giving is basically establish what your patient already knows at that time. So you might ask, "Can you tell me if you have an understanding of what a type 2 diabetes is?" Okay, so that type of question just basically checks whether the patient already has prior information about the condition. Another style could be pausing periodically when you're giving information, because when you're pausing, you're also giving the patient a chance to respond to your statements or your explanation. So if you say things like, "I would like to recommend some painkillers for you." If you pause in there, the patient might have some questions about painkillers and could potentially ask some questions. So basically, pausing gives your patient a chance to respond immediately if they want to. Part of information giving is also encouraging the patient to contribute, their reactions or their feelings towards your explanation or your recommendation. And lastly, checking whether they've understood the information that you've given them, okay? Or asking questions to discover if they need more information. So things like, "I hope my explanation is clear, but if there's any further queries from you, please feel free to ask." So this type of conversation means you've given them the information that they require, but at the same time you're also giving them a chance to see if there's anything else that they would like to know. So as you can see, the 9 criteria in speaking works together to give you an overall feel of how your speaking ability is. In order to get a good grade in speaking, or to get the passing score of grade B, you will need 5 out of 6 points in linguistic and 2 out of 3 points in the communication criteria.